So hi everyone, welcome to the featuring page section of the TBPPM Learning Network. In this section, we will be highlighting innovative projects and interesting practices that our community members have been involved in. It's a platform to share your work with the rest of the community members and also learn from others involved in private sector engagement and tuberculosis care. This week we have with us Ms. Jessica Farber, the Community Readiness Coordinator for SeeChange Initiative. SeeChange Initiative is a non-governmental organization that is actively involved in the health and well-being of the Inuits in Northern Canada. More specifically, they have been supporting the Inuit community of Clyde River to co-create a truly community-led approach that addresses tuberculosis. In an effort to support isolated communities in navigating through the COVID-19 pandemic, the Communityfirst COVID-19 roadmap was developed by SeeChange Initiative and its partners. So let's now hear from Jessica. Hi, Jessica. Thank you for joining us today.
Hi, Joel. Thanks so much for having me.
Could you give us a brief overview of the COVID-19 roadmap? What is it about?
Yes. So the COVID-19 roadmap is basically a planning tool that can be used to support vulnerable and isolated communities in responding to COVID. It's organized into 3 sections: organize, prepare, and respond. And we've actually just added a 4th section on there for the recovery process. So what the roadmap consists of is this website where a community leader, community organizer could go through step by step and to see all of the steps and sub-steps in these sections in order to create their plan. And on the website, there's also a checklist, which can be downloaded or printed out, and that can be used as a template to create a plan for a community. There's also resources on every page of the roadmap, on every step, which are easily replicated by communities. There's many infographics on hand washing, on mask wearing, on general prevention strategies, mental health, etc., that communities can repurpose and use, and as well as case studies and examples from other communities. And in addition, it's not just the website, but as part of the initiative, we, the SeeChange team, and some of our partners are also providing training and advice, workshops, webinars with community members, community leaders who are interested in implementing this roadmap.
That's great. That's great. So what inspired SeeChange to come out with this roadmap?
Yeah, so SeeChange was founded in 2018 by Rachel Cadell-Monroe, and the founding project was around tuberculosis in Clyde River in Nunavut. So Clyde River is a small community in Nunavut. And basically what this initiative did was to create a community-first, community-driven model to addressing tuberculosis, and that involved TB workshops and other activities that were really driven by the community. And when COVID struck in March, and Clyde River as a community was preparing to respond to COVID, they contacted SeeChange because we're partners, and they said, what are the steps that we need to take? They're very concerned because this is a community with a TB epidemic, like the majority of communities in Nunavut. And they were very vulnerable to COVID, which is another respiratory disease. And so they wanted help with creating a plan to prepare the community. So what we did as SeeChange was we set out a number of steps, and we worked with the community to help them adapt this to their realities. Because really what was missing in plans and documents that the government gave was something that could really be adapted and that was relevant to the specific context of the community, their vulnerabilities. And they didn't necessarily have the resources, the materials, the guides to go along with this plan and to be able to roll it out quickly. So that's when we created this sort of step-by-step framework with the community, and they used it to prepare, to organize, to do many different kinds of prevention activities, radio shows, window decorating contests, etc. And then they said that they would be really happy to share this with other communities because they felt that if it worked for them, it was something that could be adapted to other realities and other people who were facing the same challenges in terms of COVID prevention. So we decided to create something that was a generic framework that could be adaptable and flexible and used by communities in all different contexts. So that's when we ended up partnering with Doctors Without Borders, Médecins Sans Frontières Association in Latin America, and they helped us to reach out to communities in Latin America who were also interested in having this sort of planning support.
Okay. So did you have any challenges while developing this roadmap, or any significant challenges that you had to overcome?
Yeah, there were many challenges for sure. One of the key challenges was, practical challenge was internet access and reaching communities who are more remote, because this is a website, or part of it is a website. And as well, everything needs to be virtual nowadays. It was definitely challenging at times to reach communities in the North as well as in Latin America. And then one of the other big challenges that we faced was just these community organizations, grassroots organizations, facing a huge lack of funding and other resources. So one key piece to this roadmap that is often essential for a successful implementation is to have a focal person in a community organization who can help to coordinate, to go through the plan and just be that key person. But with these communities facing all of these other issues in regards to COVID and the economic impact especially, it was often hard for them to actually have a key person to assign and dedicate their time to doing this roadmap. And one of the other key issues that communities have often told us that they're facing in terms of COVID is the lack of food. Food insecurity is really big, especially in Honduras, Guatemala, and communities that are already living in extreme poverty that's only being exacerbated by this situation. So their concerns are very profound, they're great, and it can be hard to address and hard to prioritize. But that is where this roadmap can really help. It's to say, we understand there's a lot of challenges right now, but let's go through and create a plan and to see which steps are already being covered and where there are gaps that need to be filled and which ones need to be filled first.
Okay. So is Clyde River the main focus of this roadmap, or is there scope for development in other communities as well?
So Clyde River was where the roadmap started. It was the first community to use it, and it was definitely inspired by the experience of Clyde River and co-created with them. Since then, we have expanded, as I mentioned, to working with many communities throughout Latin America. But we don't see a geographic limit on this roadmap. It could be adapted to other contexts. We have been having discussions with organizations in East Africa, as well as in the US, and other communities in Canada to see how it could be adapted to other contexts. But yes, the plan is definitely to reach as many communities as possible who could use this type of support.
Thank you, Jessica. So in general, how is the COVID situation in this community? Do you have any inputs on that? And is your program being affected by because of the pandemic?
Yeah, so the COVID situation in Clyde River is still at 0 cases. It's actually been at 0 cases in the whole territory of Nunavut, which is quite good. In May, there was a false positive, but that was false. So luckily there are still no cases. But what that false positive did do was to provide an opportunity to really create a very robust plan, because there was this feeling that there was an urgency. So perhaps that was a blessing in disguise, but no, there continue to be no cases. But the community is continuing to wear masks and continuing prevention activities.
Has there been any effect on your TB services that the SeeChange has been doing?
Yeah, so SeeChange had developed a model for TB community empowerment workshops that has now had to go online. So it did definitely affect the way that these workshops were done, but it also provided us an opportunity to think about how we could innovate the model and adapt it to work for virtual as well. But in many ways, it's also been a way to adapt our other types of TB programs, and it's normalized the online workshop, which is actually pretty positive, because in remote communities it can be hard for people to travel from far away to attend workshops in these different communities. And it's also raised a lot of awareness about airborne disease, COVID being one, TB being another. So many of these prevention methods that we've been doing for COVID have actually, I think, been quite good for TB, and mask wearing as well. And it's also activated the community's communication networks. Now there's lots of sharing of information and raising awareness, and I think it's as well sparked a lot of mutual aid, and that's true in communities all across Canada and around the world. A sense of solidarity, neighbors are helping each other. So in that sense, it's been quite positive for the TB efforts as well.
Thank you so much, Jessica. That was very informative. Do you have any closing comments for our TBPPM members? If they are involved in similar work, what would you advise them?
Yeah, I would, jumping off of what we were just talking about how COVID's impacted our initiatives in TB, I would say that this is an opportunity to change the discourse around TB, to ensure that policies around TB and programs are community first, driven by the community. And we can really look at what types of community-based initiatives came out of COVID, because there's been so many, and they've been all over the world. And it gives us a new opportunity to talk about TB in a different way. I think more people know about respiratory infections. They know about air droplets. There's people who never knew anything about airborne diseases, and who might not have listened to that before are now really aware. So I think that's a huge opportunity for TB activists to raise awareness about TB and about prevention as well. And I think in terms of stigma reduction too, this is an opportunity to look at stigma and think about that in a new way, because I think COVID, it's definitely destigmatized mask wearing and other aspects that could be helpful for TB too.
Definitely. Those were great suggestions. Thank you so much, Jessica, for speaking with us today. It was a pleasure to hear from you.
Thank you. It was a pleasure to speak with you.